sometimes I don't. Okay. So we're going to have our first exam next week. So it is a lot of content. I asked you guys to do your reading and you had the PowerPoints for last week. We are going to do a little review to begin class tonight on all the content from last week. So that'll be good for us to review. I would ask that everybody turn their cameras on. You guys know that's the drill. And if Dr. Brown pops in, which she does tend to do, then she gets is not happy if the cameras are on. So we will go through a review that tonight. We're going to go through 18, 19, 20, and 31 as well. And that'll take us through to the exam. I'm going to offer a review session. I will send out a study guide maybe tomorrow for our exam. Our review session will be offered Friday at 6 p.m. your time, 4 p.m. my time. I do that because I want to give you the weekend with that study time. Okay. If anybody wants to meet with me privately, I'm happy to do that. Send me an email, send me a text, and we'll get it on the calendar. I'll review the study guide. I will tell you that almost all the professors are doing a review session, so we will record them and we will post them. So if you can attend them, the best success I've seen from students is they attend one of the review sessions and then they listen to the other ones. So that, like, if you're driving in the car and you listen to it or whatever, it's a good way to just like kind of process the information from different presenters. Okay. So I am asking you guys though to attend one of the review sessions. We take attendance, but I'm just telling you, if you want to be successful in this class, that is your best bet. Go to one of the review sessions, ask questions, have your study guide printed out, highlighted, anything you don't know about. I'm going to take attendance real quickly, and I see we're a couple people short, but I'm okay with that as long as they show up eventually. But any questions for the good of the order before I take attendance?
Are you going to send this week's PowerPoints to us?
Yep. And the reason I did not is because we're going to go over a couple of them tonight.
Okay.
And so I wanted to go over them with you guys before you're just put out there to go over them. But yes, I will send them tonight after class. Okay.
All right. Thank you.
That'll be 18, 19, 20, and 31. All right. So
Question.
I actually have a question.
When you said you were going to do the recordings for the exam review, like I have to have a class on Friday. So you said the other teachers will have exam reviews. Will they be in the evening or on the weekend?
They're all different times. So just keep a look at the schedule. We'll have a schedule come out to you guys for the review sessions. I think Dr. Lundy probably has it out there. She'll probably have it out there today or tomorrow. And so then you look at it, but yeah, they're all different times. Some are at like 1 o'clock in the afternoon. I do 4 o'clock on Fridays because I feel like it gives us a start to the weekend just to study. And I've had a relatively good turnout. So that's why I do it at that time.
Okay.
Okay.
Actually, I have a question.
Yep. Go ahead.
I'm a little confused about the discussions.
Okay.
Are we supposed to email those to you? Because
no. You should be able to post them under the assignment. If you click on discussion, it should allow you to post them. Because for the discussions, member, you're going to be responding to classmates. So you got to look at theirs too.
You click on reply. You click reply.
Reply to whoever you want to reply to. I will also mention to you with the discussion questions in your responses, I do expect APA format and I do expect references. You're not going to get credit for saying, I agree with what you said. Good idea. You're just not. So, you know what I mean? So don't even do that. Please don't forget to respond though, because a lot of people forget. Discussions are due Wednesdays and responses are due Sundays. Okay, so it gives you a little break and then you can respond. Any other questions about discussion? Because that's a good one. And when I say use APA format, what I mean is I want you to go out there, find a reliable source, don't Google something, find a reliable source like a nursing journal or our textbook or something and respond that way, okay? So you're gonna use some of the material there and you're gonna cite it. Everybody clear on that? Okay, good. All right, so any other questions for the good of the class? Nope. All righty, let's go for attendance real quick. Norma.
Here, I have a,
Hi, Norma. Ariel?
Here.
Great. Roxanne?
I'm here.
Great. McKenna?
here,
Michelle?
here,
Jamie?
Here.
Courtney?
Here.
Tiffany?
which one?
Oh, that's right. We have like 6 of them. Tiffany, I.
Here,
Okay, Leah? I saw you.
yes, I'm here. Hello.
There you are. Hi. Tiffany L.
Here.
Great. Kathleen?
Here.
Erica?
Want to stay, please show
No,
back.
Erica? You're here, Erica. There you are. Jennifer M.
Here.
Great. Pete? I saw you, Pete. You have your mask on. There you are.
Here,
Are you at work? Are you at work,
I'm at
Pete?
school.
Oh, you're at school. You have to wear a mask. Yeah.
I'm on
Yeah.
Campus.
Barbara?
Yes, here.
Thank you. Macy?
I
No.
made my talking husky with a fish to see her reaction.
Uh-oh. Somebody's kid is listening to something.
Macy's here. She's just trying to. So,
Okay, she's trying to log on or something. Heather?
I'm
Where are
here.
you? There you are. Hope?
I'm here.
Thank you. Tiffany? Or?
I'm here. I have a question about the NCLEX questions.
All right, hold on one second. Janice?
I'm here.
Lamecca? Lamecca. Well, she might have had to switch classes, I think. Priscilla? No, Priscilla? Okay, what was the question about NCLEX?
Do you want us to do them all at once, the 50 questions, or can we break them up into 2 different ones?
No, they have to be submitted as 50. Because the way you score on that is it's out of 50. So if I get only 25, then it won't let me give you full credit. Does that make sense?
Is there any
No.
requirements on the NCLEX, like what we score?
No, it's just a grade.
Okay, so
You want
whatever
to
we
do
make
well
is what
though, and
we'll
I
get.
think on the NCLEX, I'm pretty sure in the NCLEX, you can take it again.
Okay,
If you are an at-risk student and you know who you are, if you are repeating this class, I would ask that you reach out to me this week because I want to make sure that you guys have as much support as you need throughout the class, okay? So I'm going to leave that up to you. I do know who you guys are, but I need you guys to take responsibility for that. I'm going to start tonight. We're going to do some review questions. And I put it on a PowerPoint and then we have our explanation. So what I'm gonna do is I'll put up the question and I want you guys to answer in the chat and then I'll call on somebody to explain why you thought what you thought and we'll go over rationales on it. So this is really helpful for test taking, you know, and it'll cover some of the content. Not all the content from last week, but most of what we wanted to. Any questions on the Healthy People 2020 that you guys were gonna review? No? Did you guys review the site? Maybe?
Are we gonna be split up to groups to do it?
Yeah, I'll do groups for everybody. I think the groups, what I did last time, and it seemed to work better, is I split you up by a campus. But I'll sometimes split up the campuses just because what I found when I don't do that is people have a hard time, nobody answers, texting, all this other stuff. So I will definitely split you up based on that. If you don't care and you want to go to a different campus, I can do that, but just let me know that. All right, so let's take a look at these review questions. I have so many things open right now, so hold on. Okay, can everybody see? Okay. A nurse in a clinic that provides direct care services to clients with tuberculosis would be classified as practicing. Community, so there's no A, B, C, D, but the first one's A, second one B, C, and D. Community-based, community-oriented, institutional, and public health. So put your answers in the chat. Okay, I'm gonna randomly pick on somebody. I'm not saying your answer is right or wrong, but Janice, why did you pick what you picked?
Okay, can you hear me?
Yep.
Yes, because like diseases like tuberculosis is handled by public health nursing.
Okay, I did not see anybody that had the correct answer on this one, just so you know. So this is a topic that was in your reading, and this I need you guys to know. Community-based versus community-oriented. So we're gonna look at our rationale here. If I can get to the next slide. And that's directly out of your reading. So as a community-based nurse, we're gonna give direct care to people that from a oriented framework, meaning we look at community orienting and public health nursing. So institutional nursing is generally delivered in a hospital or nursing, and public health is a very broad term. So you're not gonna, this is process of elimination, which would be your best. So the best definition here is our community-based nursing would be our choices here. Public health was A, not in the reading necessarily about this topic, but B, also be very careful about what you're doing with your picking choices. All right, let's look at number 2. Jennifer's a nurse in a family medicine clinic today. She is assessing Jose, a 4-year-old, being seen for an earache. This is going to be key. You need to really, when you're reading your questions, you're going to say, what's important? Do we care where she's a nurse? No. Nice to know, right? She's looking at Jose, who's a 4-year-old being seen for an earache, and that's going to be your emphasis here, being seen for something going on. So pick your choices, A, B, C, or D, community-oriented, community-based, public health, or tertiary health. Oh, we got a bunch here. Majority says B, it looks like, a couple A's and D's in there, but Courtney, C, can you tell me why you chose what you chose? Courtney?
This is going to be more of like a family practice based kind of medicine.
Okay, and so
So
why
actually,
would, go
that would
ahead.
be more tertiary, actually.
Okay, so be very careful about this. You guys did some reading last week about primary, secondary, and tertiary, right? Does anybody remember what that focuses on? So it's your levels of prevention. It's not necessarily going to be your levels of nursing. So this question right here is trying to get you to pick something that you might have seen, but that's not really the title that we use for it. We're going to look at our rationale on this one again. And this is going to be our community-based nursing. So there's community-oriented, which is going to focus on the well-being of the community. And then you have community-based, which is going to be focusing on illness care. So the fact he had an earache was your key right there. Okay, so you need to know those two terms. I will tell you that you're going to see that on your exam. So community-based and community-oriented are two different types of nursing that we do as community nurses. One is going to be caring for illness, and one is going to be more caring for the health care of the community, caring that everyone's doing well. Okay, so your key in that question was about the earache. All right, any questions on those two terms?
What was the other one? You had community-based nursing, and what was the other community what?
Community
nursing?
oriented.
Okay.
All right. A school nurse teaches 3 middle school kids with asthma condition techniques to minimize their incident of bronchial spasms. This is an application of, we have our same choices again. Community-based, community-oriented, institutional, or public health. All right, we got a bunch here. Bunch of different choices. Alrighty, Michelle, did you pick one?
Yes, I picked B.
Why'd you pick B?
I picked B because community-oriented nursing, the goal is to preserve, protect, and promote or maintain the health.
Okay, and so what are we doing when we're dealing with these kids with asthma?
Explaining to them how to use their inhalers
And we're making sure that we're doing that to do what?
to prevent asthma attacks.
And to promote their self-care, right? And so
Yeah.
this is another community-based, and so that's where we're gonna see that term again, okay? So know that community-based and community-oriented, it's always gonna be family-centered, which is always the case, but you're gonna pay attention to particular things within, you know, our communities and our families. And so those terms are two things. So I've given you now two examples of both different kinds.
Okay.
Okay. All right, now this one may be more than one answer. The public health nurse deals with the examination of a community setting to determine the community's health status. Which of the following should be considered in the assessment phase? I want somebody to tell me out of this question, what's an important word that we're looking for?
Assessment.
Good. So when we're looking at this, you know, we're determining health status, which we do certain things when we do that, and that was in your reading, which we'll talk about in a second, but we're doing assessing here. So let me move us because. So maybe more than one choice, I will tell you that. But when we're assessing as a nurse, it doesn't matter what kind of nurse you are. What are you going to be doing during your assessment process?
You're collecting information.
Okay, you're collecting information. What else are you doing on an assessment? When you're looking at the resources, what they have, what they don't have. It's going to be a big part of dealing with communities. What's available to them and what's not available. We're going to see, like in rural communities and urban communities, what's available to some is not available to all. We know that, right? So when we're looking at the assessment phase, I only have a couple in the chat there, so I'll wait a couple more minutes. Hope, tell me why you chose what you chose.
Because yeah, when you're assessing, you're collecting data, analyzing, you're gathering information, and then of course you're questioning the family to again gather more information. So you have a full picture of what's going on.
Okay, so you're
didn't choose a
collecting
valid-
information.
Yeah.
What else are you doing?
Questioning the availability of the health services so you know. Well, actually, I take that back. I think it's just C.
Anybody
Is it
have any
what-
thoughts?
Because evaluating is not assessing. If you're evaluating, that's after the fact. I think it's just C.
I think you have to evaluate to do a proper assessment. You have to look at what's available. Is it reaching everybody? So let's say it's a city can have, you know, rural population that may not get the services available if you live in the immediate city. So I think to do a proper assessment, you have to collect data, analyze that data, and, you know, really ask questions before really drawing conclusions and deciding how you're going to proceed.
All right, so what we're going to look at here is our health assessment is going to, let's go back to our answers because this, I sort of, you're going to be evaluating, and Norma, thank you for your input. You're going to be evaluating here, not evaluating what you've put in and what you've implemented. So I hope you're right about that. If you had put something in place and then you were evaluating, but look, we're really just looking at the surface here. We're evaluating our social, economic, and environmental characteristics, right? So we're seeing what do they have, right?
Mm-hmm.
We're going to be questioning what services are available. We're going to be collecting data. Okay, we're not going to necessarily be implementing plans on our assessment phase, right? Because that we have to make a plan before we, right, implement and evaluate. And so you're always going to work with your community in your assessment, because you need them to feel like in any nursing, you need them to have some faith and some trust in you. So when you're thinking about that, so those would be our answers for that one. Okay. Oops. Oops.
So then
Alright.
it was just the collecting, so it was just the collecting, analyzing, and the questioning. Is that what you're saying?
It was all 4 of these. Building
So-
to work with the community, you're collecting data, that's your assessment there. You're seeing what is the environment, what does it have? So I know where to start with. And you're gonna say, what services do we have? Because before I can do anything for them, I need to know what do they have available. Does that make sense? Yeah, no, maybe. All right, in a federally funded preschool program such as Head Start, nursing services that include developmental level screenings for cognitive and psychomotor development of individual children would most likely be considered community-oriented nursing care when, and I want you to look at this question and tell me what are my keywords here. Anybody, what's my keyword as I'm reading this question? I know it's a heavy worded question, so. If I were taking my test, what would I be thinking?
The screening.
Okay, screening. Mhm.
I think federally funded and developmental level.
Okay. Depending on the
Nursing services?
question, what I will tell you is that the fact that it's a federally funded program such as Head Start, that's one of those nice to know. Not going to help us with the question necessarily, unless it said what services are provided, right? What federal services are provided. We don't really care. I mean, when you're looking at the question, there's another word in there though that you really should be focusing on.
What
would
would
be
nurse
like
consider
the-
community-oriented nursing care?
Yeah, the bottom half of the question.
Yep. So we're looking at community oriented. Remember, we talked about this now several times. So here is what we look at. Individual results are compared with standards for children. Program characteristics are assessed for their effectiveness. Referrals provided or treatment is initiated. And when you're reading these answers, I want you to really try not to pull out one word and say this word will make it wrong. You know what I mean? Try to look at the whole picture.
I actually have a question now.
Yep.
And I'm looking at answer C. It
Mhm.
says referral is provided for a child identified with delayed psychomotor development. Would you classify a referral as a treatment or more of a prevention method?
Well, referral, in order to have a referral, you'd have to screen them and get the results and then provide a referral. You know, you can't just, in the beginning stages, you're not going to be doing a referral. Does that help?
Yes.
Like, you know, it's not like an insurance referral. It's just like, you know, I don't know anybody work with little ones? Little people?
I used to. I used to. Now I work with VA vets, so
Oh, wow.
far removed from little ones now.
So
I
it's
work
really
in between the regular ED and the pediatric ED. So
all right. So you're going to know, and in the emergency department, you're not going to be seeing this like screening and stuff like that. This is going to be more community based in the sense I do tons of screenings in my job. And remember, I'm a school nurse and it's in the community. So you're going out there. So, you know, pediatricians do a lot of screenings too. So when we think about that, we're going to see pediatric nurses in an office. You're going to see this type of screening go on in developmental levels.
I have a lot of experience with it because my daughter's on the spectrum. So kind of, I see, like, I volunteer in like the B2 program and stuff like that down here. So I I see it from that aspect, like from a parent's aspect.
Yeah, well, good. That's parenting, I think, is I always say this to fellow nurses and colleagues and teachers. I mean, once you're it's not that you have to be a parent to understand children, by no means, but I can tell you just from being a parent, I would not sit there and say that every child should be on the same page at the same point, and I'm okay with that. And so I think there's a lot of judgment that's gone on with the pediatric population about why isn't this kid doing this? And I was just talking to my husband the other night about it and saying, like, he said, you know, when he was in school, there was like ADD. I mean, you know, there was like 1 or 2 kids, and he said he wouldn't have even known it. Now in our populations, I mean, they're all over, and it's, you know, I'm not saying it's not legitimate, but I just think we need to be really cautious when we're using titles with like developmentally appropriate, and, you know, is a single child going to function differently than a child of 8? Probably, right? So being a parent, for me anyway, has put a whole different perspective on what's normal, because what's normal for us is normal for us as a family, right? I don't care what the school says, you know, and I think as a parent, you come to realize that there is no such thing, you know, as a normally developed child. I mean, are they walking, talking, our gross motor skills? Of course, right? Our fine motor skills, but I'll never forget them coming to me when my daughter's in kindergarten telling me she didn't cut with scissors properly. And I'm like, in the grand scheme of life, I'm not worried whether she's cutting with scissors, but they were all worried about it because it was not developmentally appropriate. I said, well, she doesn't cut in my house because I don't want her cutting her hair. So, you know, so just, you know, put it in perspective sometimes with these developmental, and I appreciate your input about having a child, because it really puts things in perspective sometimes. So when we are doing this, we're being compared because it's our community nursing, and we're looking at the community orienting perspective. So we're going to be looking at how we're comparing those results with standards of another group. Okay. We're going to skip this because you guys focused on public health a little bit. So let's look at this. A nurse planning a cessation clinic for adolescents in the local middle, high school is doing what? Community-oriented, community-based secondary care, tertiary care. So when I'm reading this question, just throw out there, what are some things that are going to be important when I'm looking at this question?
Smoking cessation and planning and providing, and then the age.
Yeah. And sometimes you'll see a smoking cessation clinic for those who are in elementary school. So that might take it to another level, and we'll talk about that in a second, but let's see some of your answers here. I love that we get all these different answers. It's amazing. And it's good. It's why this is the whole point of this, is for us to talk it out and say, anybody want to tell me why they pick what they pick? If you don't offer, I'll call on somebody, but I just like to offer it out there.
I picked community-oriented care, again, because we're focusing on health maintenance and prevention, which is the theme with community-oriented care, because we're not seeing a specific disease or illness, we're just seeing prevention and maintenance of public health.
Okay. Anybody else out there? No? Well, thank you. So remember, here again, we talk about community oriented. We're emphasizing health protection, maintenance, and promotion, disease prevention. Okay. We're not looking at there's something wrong with them, right? In my explanation here, this is a key concept that we are going to spend the entire semester talking about. It's primary, secondary, and tertiary prevention. Okay. As community health nurses, and this is in our second I'm sorry, third paragraph there. So it says community-based care is nursing care that's provided in a setting. A smoking cessation clinic is an example of primary prevention. So primary prevention is when you're trying to, and the way we teach this is primary means prevent. So if you're trying to do something to prevent it, like in that setting, the high school and middle school kids in that particular setting are not smoking. But once we go to our secondary prevention, it's going to be our screening levels. So this is where we do screenings for things and we try to figure out, okay, where is the problem? And then we get to our third level, and that's called tertiary. And that's going to be when we have to treat. Okay, so this was a good example here of why. So if the question said, a nurse is planning a smoking cessation clinic for adolescents who are currently smoking, okay, then what kind of prevention would that be?
Secondary.
Well, they already have the problem. They're already smoking.
To be
The
tertiary.
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 It's a treatment to help minimize our complications. Okay, so the best way for you guys to remember this is primary is prevent, secondary is screen, tertiary is treat. Okay, so it's just like a little lingo for you guys to remember. You are going to need to know this. I will tell you the entire quarter. You will see this on every exam. So you will see it on this upcoming exam, not necessarily this situation, but about primary, secondary, and tertiary, because we do it so much as community nurses. We do so many different levels of it. So important topic. It was in your reading, and we're going to go through it tonight as well. Let's go to our next one. I don't even know what screen we're on yet. Okay. Community-oriented nurse has identified obesity as a problem in the middle school. The next step in a population-focused practice is to make information available about the health of the middle school students. This describes the public health function of assessment, assurance, policy development, or research. So what I will tell you guys is I can't encourage enough reading from the textbook, but these questions come directly out of it. So you're probably guessing now because you don't know the content, which is fine, but just know for your test, you're going to need to know the content in the reading as well as what we talk about. I don't have a lot of answers on this one, so you just want me to give you the answer. It's going to be our assessment, okay? Why is it assessment? Somebody tell me, anybody.
It involves when you collect the data and you monitor the population, and then you make the information available for others.
It's just good.
Like health.
Yep, it's gathering data. And that's what we're doing when we're assessing, right? Okay. Nurse volunteering at the free clinic in her community informs a client seeking treatment for hypertension that the family's child may qualify for enrollment in the state children's health insurance plan. The nurse's intervention can reduce health disparities, which is another topic that was covered in our reading, health disparities for these vulnerable children. And I want to know from anybody, why are they vulnerable?
Because they can get hypertension as well.
They're low-income families.
It's it's a free clinic. So you know that it's probably a low-income family if their parents are seeking care at the free clinic. And that puts them in vulnerability because they don't have the financial resources to get health care.
Okay, we're going to talk a lot about vulnerable populations, and I will tell you something that what vulnerable means in this situation is that there's something that's interfering with their access to healthcare. Does not mean money necessarily, but it does mean that they're vulnerable and therefore that makes them vulnerable. But I want you guys to think about what can we do to reduce health disparities. Direct financial subsidiaries for children, funds to ensure currently uninsured, outreach efforts to enroll eligible children in Medicaid, and prospective payments for child services. What do you think would be our best option here to reduce the health disparities? I'm gonna wait a couple more minutes for some answers.
I'm waiting.
Bye. So sorry. Okay, so let's take a look at our answers and our rationale. Most of you guys picked C, which is going to be outreach efforts to enroll eligible children in Medicaid. But what I'm worried about here is, what if they don't qualify for Medicaid? Right? Then that's not really going to help with our health disparities. And Medicaid is a very precise program. And when you're trying to make it so that everybody can get services, what you're looking for is giving some funds, giving some assets to those children that are currently uninsured. Medicaid is one form of health insurance, right? It's not the only, and you do have to have qualifications and stipulations with it. So that's why your answer there would have been funds for the currently uninsured. Oh, I like that one. Hold on. Oh, well, I gave you the answer already, but it's okay. A city uses the local media radio to post ratings of air quality on days when the air quality is poor. It's directed toward old adults, very young members of the community, and those with chronic breathing problems. This is an example what we just talked about with our vulnerable populations. So our Our vulnerable populations are those who have an increased risk. We are going to be very specific in our reading about who the vulnerable populations are, but it's a subgroup of the population that's going to be more likely to develop health problems, can be financial, does not need to be, or have worse outcomes. Can anybody from their reading tell me who's one of those people that's part of that vulnerable population? Think about it. Who's going to have the worst health outcomes? Who's going to have risks probably from environmental hazards, personal
People with asthma.
behaviors?
Low.
Not asthma. It's a general group.
Low income family.
The homeless population.
Good. That's what I was thinking of, the homeless, but homeless is one of our big ones. Think about it. They don't have the means, right? They're vulnerable to because of lifestyle choices, right? Because they're trying to get by, they're trying to survive. So are they, is our homeless population going to have the same means that someone else is going to have? Absolutely not. A lot, and I don't know if anyone's worked with the homeless population, but with my experience, oftentimes the homeless population doesn't even want to go to the shelters because they're afraid. There's a lot of mental health concerns with the homeless community. So think about all these things and how is that impacting their overall health, right? They're eating whatever they get their hands on. They're sleeping with not many resources. So just think about that when we're looking at our vulnerable population. You guys are going to have a paper on a vulnerable population, sort of a windshield survey and you'll learn about them a little bit more. All right, I'm going to stop here. Were these questions helpful or no? Good? No? Some so. Okay, so I wanted to go over that with you. That's some test taking stuff. Oh, thanks, Kylie. some test taking skills and the topics that we covered last week. Are there any questions on what you covered last week? And we're going to move forward to this week. No? Nada. All right, so we're going to start this week, and the first chapter is really about family and our dynamics and our demographics. So I'm going to throw out a question to everybody, and anybody can answer. Who is your family? If I said, who is your family, what would you tell me?
The people in your household that you have everyday relationships with and bonds with.
Okay.
Parents and siblings.
Parents, siblings, people I live with, parents, siblings, children.
Technically, the book says that the definition of family is those you consider like closest to you, because the traditional family is different than it was before. It's more based on those who you consider your family and those who you consider important.
Okay, so there's, yes, sort of ish. The book covers very specific things that they will look at when you're looking at families. What I want you to think about broad spectrum wise, though, is the different types of families that we see all the time. We see some people who are married. We see some people that are divorced. We see some people that are married to men, women married to women. We see people that live together, aren't married, people that live together and one has a kid and the other doesn't, people who live together because they share a home. So not, maybe they share a home for economic reasons. We're going to look at exactly what describes a family. But when you think about family, I need everybody to understand when we're going out to the community and we're assessing families, we have to be very cognizant that family is what that patient describes. So we have to be very careful. We are not saying, well, that's not part of your family. He's not related and he's not blood. If they believe that's family, they believe that's family. So does it really matter what we think? No. So a lot of community nursing, and I will tell you this, is a lot of it is putting your beliefs to the side. And whether you think that a dog is a member of your family or the patient thinks that a dog isn't a member of your family, doesn't really matter. We have to focus on our communities and what's important to them. So I'm going to pull up it out of our book. And so what I do sometimes with classes is I show you the book and I highlight it so that it can kind of like emphasize when you're reading, oh, I remember we went over that. Okay, so we're going to take a look at our book. I'll pull it up on the screen and I'll show you where we look at family. One thing about family too that is really important to remember is it's time spent together. So when we think about time spent together, that doesn't mean that they have to play cards every Friday, right? What are some things that you guys do to spend time with whomever you consider family?
Dinners.
Great.
Watching TV shit, like the same TV series.
Playing board games.
Good.
I go to ice hockey games.
Awesome.
Basically do anything as a unit.
Yeah, so think about it's good. Anything is a unit, but remember, when we're looking at families and we're thinking about, are they spending time together? And so there's a term in your book, I will tell you, I don't like it because I think it's yucky, but they call it like normal family, and the word normal and me don't go in the same category ever because I don't think anything's normal in life. So, but I want you, what they are going to classify in our reading is that a family, a normal family is people that spend time together, and that doesn't mean they're sitting in the same house not talking to each other. Okay, so remember, this is our book. This is not my opinion. I believe your family is what your family is, and every family functions very differently. For those of us that are married, I don't know how many of us are, but I will tell you this. My in-laws and my family function very differently, very differently. I don't sit in judgment. I just know what goes on one side doesn't go on the other, right? So think about that and think about your friends. How many friends do you have that like the things their families do, you wouldn't do? But that doesn't really matter to them. That's what's important, right? So let's take a look at that list in our book, because I really like to use the book and highlight. See, I have so many thingies open. Hold on one second. I'm gonna.
I'm so sorry, Professor. Do you mind if I turn my camera off for like 10 minutes? My
No,
daughter's
fine.
falling asleep in the living room and I have to switch there so she can come in here.
No, you're fine.
Thank you.
Thank you for asking, but you're fine. Let me see. Oh, yeah. Well, now the book doesn't want to cooperate with what's going on. Alrighty, so let me share my screen with you guys. And the book is being really temperamental today with me. Oh. There it is. Okay. Alrighty, so here's our book. And we're looking at here on our chapter 18 is where we are. And so here is where we look at our characteristics in the book. There's a word they use like normal or something like that. I really don't like that word, but I like this one better. It's healthy families. Okay, so this is what our book is saying. These are characteristics that we would look for. Do they communicate well? This is box 18.3 if you want to look at it on your own time on page 273. So they tend to communicate well and listen to all members. They support, they teach respect, they have a sense of trust, they play together. This is the key right here. They interact and have a balance among one another. Share time together, traditions, a religious core. I mean, that's what the book says. I'm not seconding that. Okay. And they have open boundaries that can help. So there, you might see a question if I were writing a test, maybe you might see a question about which trying to think of how I could say this. What are some activities that show the characteristics of a healthy family? So it would be something like, you know, somebody said play board games, which would be because they're interacting with one another, they're talking, they have a sense, they have like, you know, some function there. Very important in all of your reading, and I highlighted it here for this, are levels of prevention as far as family dynamics is concerned. This is on the same page. I'm sorry. On the same, when we're looking at our family dynamics and what kind of functions they have, we have primary, where we're going to educate our patients about healthy choices for young children, right? Because we're preventing our primary. I'm drawing a total blank right now, so sorry. Okay, provide counseling and weight management, helping mothers who qualify. We then look at our secondary, which is going to be our screening. We're going to screen our teens. And we're going to analyze weight and growth as part of our screening to see how do they fit in their health assessments. And then we have tertiary, which is going to be where we work with schools to improve the food because it's already being served, and help communities establish farm to school networks to ensure local foods are used in the setting. Okay. And then we look a little bit here, and I wish I could make this picture bigger. Can you guys see it? No, not really. I want you to look at this picture when you have time. 18.2. It's the way we see family. So there's family as context, family as the client, family as the system, and family as a component of society. When we're looking at our families in the community and we're assessing, we're going to look at this. So on the first one, family as content, the individual is the focus. And the family's just kind of standing there. So if you look at the picture, the little girl's in the front and the family's in the back. Okay, so when we're assessing that household, is that how we're going to see them as a context? The next one we do is the family as a client. And that means everybody, if you look at the picture, everybody's equal. You add them all together, they're all the same when we're doing our assessment. Family as a system It's how they interact. So they'll all interact. So it's not that they're all equal that we're looking at. They're all interacting in their own different ways and focusing on that. And then the last one is as a component of society. Where does the family fit, like with religion, finances, social, health, education, legal? So this is a really good chart. I do want you to know the 4 different parts as how we approach our family nursing. Let's see. What else can we talk about? Any questions about family and assessing? We'll see this when we go to homes usually, or in schools. I see a lot of this as a school nurse. Excuse me, I'm assessing the families. And I will see how the mom or dad, so I've seen a lot in my practice. I'll call a mom or dad and I'll say the child has a fever, right? And then they say, well, do I have to come pick them up? Or some say, oh my, they have a fever, I'll be right there. And some say, well, I'm at work and I can't do anything about it. So see how different that same scenario is among 3 different families? So I need you to remember that when you're looking at family dynamics in the community setting. If you're going to their home, just be very careful, because I don't know, I can say everybody's home is their home. And most people that I know are proud of their home. So whether you walk in there and there's bugs crawling all over, you have to assume that that client thinks that their home is pretty spectacular. So focus on that when you're looking at it, you know, be very clear, be very specific, do your assessing. And the most important thing that I'm going to emphasize with home visiting is safety. We as nurses have to take care of ourselves. So we're going to go into homes that can have anything going on, right? But we have to remember, what are we going to do to keep ourselves safe? This is box 18.5 in chapter 18. So first, we're going to make sure we let the office know, if we're working for an office, what time we're going, making sure we don't go in there wearing clothes that may be seen as inappropriate. We're not going to be in a secluded room. We're not going to close the door. We're going to make sure that we're sitting out with the rest of the family. Okay. You can take a coworker or neighborhood volunteer. Tell me what might be the concern there, though.
Family might take it as you're intimidating because you
What?
have 2 people there.
Yeah. What else should we be thinking of as a nurse when we're bringing a friend along?
Patient confidentiality.
Or violation of HIPAA. Is this person, you know, you have to be really careful. Are they allowed to know what's going on? Does the patient feel comfortable with them knowing? So you want to always sit between the client and the exit so that you're close to the door. If you need to get out of there, you get out of there. So anybody do home health care?
13 years.
13 years. So give us a good story about when you were uncomfortable in somebody's home.
There's a lot of them.
Right.
There was an older lady I was taking care of, and her son was a drug addict and alcoholic, and he always had friends that were coming and going in the house. They were buying and selling drugs in the house. It was not a very comfortable situation. Kind of scary.
How'd you handle it?
I stayed as short a time as possible. I tried to arrange my schedule when I knew he was not going to be there, so that I just tried to avoid any of the situations.
Good. And when you were there, did somebody else know you were there?
Oh yeah, the office always knew when I was going at the house and approximately what time.
And a little piece of advice, I would always have a cell phone with me.
Oh yeah, definitely.
Right. You never want to go into someone's home and have no resources of your own, right? So I want you to be very, very conscious of this with working with the community as a whole. You're not in a controlled environment like in a hospital. So, I mean, you can do community nursing in a hospital, but for the most part, you're going to be out in the community, right? You're going to be assessing people in their own comfort. So you have to be really careful and keep yourself safe. If you feel unsafe, leave. I gotta go. I have another client, whatever. get out as quickly as you can. And you want to check, you know, at the end of the day, just so that you let them know I'm safe, we're good, and move along. Okay. So really important when we're looking at family there. Are there any questions about family assessments and dynamics of families and things like that? No? Okay. All right, we're gonna take our break. It's 6:57. I'll see you guys at 7:07. Okay? Okay. All right, welcome back, guys. We are going to continue on and we're going to take a look at 19 and 20, chapters 19 and 20. I'm going to pull up the PowerPoints for that so you guys can follow along with the PowerPoints, and this just helps guide us a little bit. So hold on one second. Any questions about what we've covered so far tonight? No. Let's see here. Right. So when we are working with families, we're going to be looking at our health risks, family health risks, and what are some things we want to think about when we're doing this?
Family history.
Like, tell me something more.
Maybe diseases that could be genetically passed.
Good. How are we going to find that out?
Doing family history.
Yep. You guys should have seen in your reading, I believe, genogram and ecograms and what the difference is between those. One is going to be more genetically driven and one is going to be more environmentally driven. And so we're going to take a look at those and how we can assess what are some questions. How can we be therapeutic when we're asking about family history?
And ask if they're like, you ask maternal grandfather or grandmother or mother or father, like main relatives, what health problems they had and how they handled it, and like life expectancies for those members, things like that.
Okay. How might we question them on that? I mean, other than saying what did your grandfather have? What did your grandmothers have? How could we say that it might be therapeutic to our clients?
Maybe a little more focused, like did your father have any cardiovascular diseases, or did your mother have any cancer or something like that?
The thing with those yes, you're right. You're definitely going to want to focus them, but sometimes we really want to be open-ended with our questioning, right? So that we can get a lot of data.
So it would be like, what health problems did your mother have? Or like, what significant health problems?
All right, so what I want you guys to be really focused on with health assessments, yeah, you're always going to say like, what were the problems, but maybe a lot, like a way that you could say it therapeutically if you were trying to do a family assessment. Now, remember, you're not only worrying about health problems, that is a big part of health assessment, but you're also going to say things like, can you tell me more about your family, right? Because what that question does is opens it up so that the patient can feel comfortable telling you anything they want about the family. And sometimes you'll get answers like, well, my mom and I didn't get along, and blah, 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 blah. You know, like that's important though when you're doing family assessments, right? And we want to keep it as open as we can. Once you open the conversation and you develop that communication, which is community nurses, you really have to do that because that's how you get a lot of your data, is just talking to them. And has anyone done any telehealth nursing? So it's when you're on the phone. Pete's shaking his head yes, so I'm guessing he has. So tell us a little bit about it, Pete. What was your experience with telehealth?
So I've used the telephone, but we primarily use video now. Where we're at, we have, I just usually get the patient, get them set up, take them in a room and give them on a tablet with the doctor, and the doctor will sign on and be face-to-face over the tablet home.
Good. And that's probably because of COVID, I'm guessing, yeah?
Yes.
Because of COVID, I know. COVID's changed the world like tremendously. It's ridiculous. But anyway, so also you can do telehealth nursing where you're on a nurse line. So I did some work with that. And so you answer calls for patients either who have an insurance company, say like Blue Cross Blue Shield. And so the patients can call in and you assess them over the phone. The really interesting thing about that is how much data you will get from a patient over a phone. What I found with telehealth nursing as well is a lot of people, you would be surprised how many people And so I worked a 3 to, like a 3 to 2 or a 3 to 1 shift. You would be surprised how many people call at like 10:30 at night and they have nothing wrong with them. But they're
Mhm.
calling because they're lonely. So there used to be this one guy that would call. He never had anything wrong with him, but he would keep you on the phone, and you were trying to be therapeutic with him, but like you knew nothing was wrong because you got to know the guy because he called every night, right? So a lot of times you have to know when you're assessing people and their health assessments and stuff, they probably want to share a lot of information with you. So you need to be really open to whatever they want to talk about and then try to focus them back, but that therapeutic communication will go miles. Part
You
of
mean like, quick question, for the
Yeah.
telehealth, you mean like those answering services that like answer for your kid's pediatrician, like when it's past the time?
Yeah.
Like those nurses at other hospitals that just tell you whether you should go to the hospital or give them Tylenol?
Yeah, and so there's places like that. Then there's insurance companies that employ nurses, and they will say if you have a medical concern and it's after hours or you can't get to the doctor, you call. And so you get all kinds of people, but that therapeutic communication for people. I mean, there's a lot of people in this world that just want to talk. So that's part of our job as a nurse is to listen, right?
And that's kind of one of the things I'm sorry to interrupt. That's one of the
No,
things
you're
I
good.
deal with. We do at the VA hospital because of COVID and just trying to offer alternative ways in order to see their provider. We do a lot of telehealth. And so that's one of the things that we see. A lot of the times these vets, they might have a small issue, but the bigger thing is they're frustrated. They want to get everything out. On Tuesday, I tried to do this. Now my back
We
hurt. Is
see
like,
that, yeah, we see
Yeah.
that at the ER a lot. We don't do telehealth, but we have like certain patients that we know by now because they come to the ER like every
Right.
other day
Right.
with something wrong, and half of the time they just want to talk to you and leave.
Yeah, and you end up learning a lot about them because just like you were saying, Professor Alona, is you ask open-ended questions and they'll give you the whole kit and caboodle. And you take all of this, and you try to pare it back down.
And that's how valuable is that though, right? To be able to, like, sometimes, let's be real,
It
it's
provides
too much.
context. It provides context.
Yeah, absolutely.
And a
And
lot of
maybe-
time it's like a mental health struggle that they don't know what resources or how to handle it. Like we have a lot of alcoholics in the ED that they come when they're drunk, and it's just because they're drunk and they're upset at themselves because they're drunk, and they are like, I don't know how to fix this. And at the first few visits, you can't really help them. But once you get to know them and they're like, hey, it's you again, you could be like, these are some programs that we have, and they're more accepting of the programs and things like that when they've been dealing with the same staff over and over again to kind of have a relationship.
Absolutely. And I love that you say that because that's really what you want, right? You want people to disclose as much information about their family. And some people are really uncomfortable talking about their families. I mean, think about children who come from abusive families. They don't really want to talk to you about what goes on at home or what goes on the weekends. The good thing in the innocence of children, and this sort of goes into chapter 31 because of my career, but choice right now, being in school nursing, you find out a ton from children if you create that one. Just that I have students that come see me every day, and they're not sick. They just know that it's a safe place and they can say whatever they need to say for the day, but it's an interesting thing. And most community health nurses can do that. I mean, you can really develop these relationships and make it valuable. It takes us into chapter 20 sort of, because there's different phases that we look at. Let me just pull up 19's PowerPoint real quick and see if there's anything I forgot, but I think like 19 was kind of fluffy. Let's see. We kind of went over it all. So home visits, remember, we see this again in chapter 19. You have to remember, and I will tell you, this is so important as a nurse, you got to keep yourself safe. You have to take care of you. And so in a home, you have to be prepared for whatever you're walking into. You want to make sure, here's where our vulnerable populations are. But it's okay, we don't have too much on that. Okay, so really we're just looking at our family, our health risks, our interventions, environmental risks, behavior risks, and then we do the risk appraisal for that. So we're going to take a look though at chapter 20, because this is going to be a heavy part that I need you guys to know. So developmentally, so you got the family, you assess them, we know about therapeutic communication, what we want to ask them about and stuff like that, right? So, but then we move on to like, where are we going to see risks for the different groups? So I'm just curious if you had a guess, and I don't know who did the reading, and I'm not going to ask that because it's on you guys, but in your mind, thinking as a nurse, where do you think we're going to see some problems? What kind of health problems do you think we're going to see with children?
Obesity, diabetes.
Okay,
Anxiety and depression.
good.
A lot of upper respiratory stuff, colds, flus, ear infections.
Mm-hmm.
Hunger.
Hunger.
Abuse.
Hmm. We're going to see abuse with kids, and who else?
Elderly.
Elderly.
Right, the elderly. That's a major thing with elderly population. So chapter 20 really hones in on the different groups and what do we look at when we're looking at them. This is I need you guys to know this information. So I'm going to pull the PowerPoint up. We're going to share it together, and I will send it to you at the, like I told you, but I can't emphasize enough how important this is. So when we look at children, obesity is going to be our number one concern. Well, not our number one. It's a big concern. Everybody knows what's going on in the world today. COVID has created a world where, and I mean, I don't know if you agree or disagree, somebody can say, but I don't think COVID has helped children's health at all. From sending kids on iPads to not allowing kids to go out, because who do you know they're going to be exposed to? So we're seeing all kinds of children areas that are really, really hurtful. So somebody talked about asthma. We do worry about acute illnesses. Our biggest one though is going to be our injuries and our accidents, because think of school-aged kids. They fall, they break more bones, they, ride their bicycle. What's going to be a really important teaching tool for us with kids if they're riding their bike?
Helmets.
Helmets. Yep. Helmets is going to be your number one for bike safety. Okay, so we're going to look at that because they do have accidents and they do fall. I mean, that's just kids, right? So we're going to look at our developmental considerations. Abuse is always a concern with children, and our chronic health conditions like our asthmas and things like that. When we are looking at our areas of prevention, hold on, let me make it bigger for you guys. When we're looking at our areas of prevention for this age group, we're going to look for smoking, because what is that going to be at this age? What kind of prevention is smoking education going to do? Is it going to be primary, secondary, or tertiary?
Primary.
Primary. Somebody give me what? Michelle, why would it be primary? Sorry, I'm just calling on you. I just saw you.
Because primary is preventive.
Mm-hmm. And I mean, there are some elementary school kids that smoke, but I mean, not many, hopefully. Right? What else do you want to think about with kids? We talked about obesity. There's something else that goes on in households, and I can tell you because I live in the state of Colorado. It's legal to have them in your home, and pretty dangerous for kids.
Prescription drugs.
Firearms.
Yeah, well, drugs is definitely one of those. And with drugs, I want us to think about if a parent says that they're vaping. What do we know about vapes and kids?
They think it's cool.
It's flavored, so it's geared
It's
towards
flavored like their M&Ms and their Skittles, and they think it's for them.
Yep. And what is poisonous in a vape for a kid?
Tobacco.
The oils. The oils in the vapes are poisonous for a child. So a kid may say, like you said, it tastes like chocolate. It's whatever.
Mhm.
If mom and dad say though, oh, I only vape around them. What might we say therapeutically to the parent? Because, here's where we have to be careful, guys. We can't be judgmental, Because the minute you say to someone who smokes, you shouldn't be smoking,
Sense mode.
they're done. They're like, they don't even want to talk to you. So what is something we could do if they say like, oh, I just vape around them?
You could be like, that's a great tool for smoking cessation. And if it's helping you, that's awesome. You just want to keep in mind to keep it out of the reach of your children. More importantly, the oils, because those oils are very poisonous and you don't want your child to get into them. Or you could tell them to take the oils and put them separate from the vape when they're not in use, things like that.
What's something that Ariel said that I would be very careful saying to somebody? She said, it's awesome that you're doing it. So what
Right.
is that telling the patient?
That it's okay.
Encouraging them to smoke more.
Well, the nurse said it was fine. And that's what they'll say. They'll say exactly that. Well, the nurse said it was fine. And so you have to be careful when you're doing that. And I like that you acknowledge that, because they're going to do it whether you like it or not. Let's be clear, right? But by giving them some confirmation. So say, I know that's helping you with your smoking, you know? You see how we change the way we say it, just so that they don't say, oh, the nurse said it was okay, because they'll all tell you that. And they'll go to the doctor, oh, the nurse said it's fine to vape. And, you know, as nurses, we probably shouldn't be promoting vaping because it's not healthy, right? So just think about when we're talking to our patients, you want to acknowledge what they have, and particularly with little ones and smoking, know that vaping is no better for little people because they can get a hold of it just as easily, right? And so just think about that. What else with kids? Accidents, we talked about bikes, helmets. What else could we talk about with kids? Immunizations is a huge one. I will tell you, in the world we live in, I deal with this all the time with school age kids. And so whether parents want immunizations or not, that is not for us to judge, right? You can have your own say on the immunizations, do whatever you want with your own kids. But for parents, all we have to do is educate, and we have to say, this is what is recommended. If you don't want to take it, can you help me understand the reasons why, right? Because if we say, help me understand the reason, or can you share with me what you're concerned about, right? And so be careful with that. I can tell you, I don't know how many of you had the experience, but how many people, when my daughter was little, they'd be like, oh, don't give her this and don't give her that. And I thought, and I was a nurse at the time, and I'm like, huh? I'm like, why wouldn't I give it to her? I had some woman walk up to me on the beach one day and she goes, oh, don't give your kid. And I'm like, who is she? So just realize parents get a whole different bunch of input from all different sources. So be careful with that, and just, you're going to educate them. And environmental health, what are they being around? We have these different acts as we move into adults, and I would like you to know them. So there's American with Disabilities Act. Anybody know what that one is? It has the word right in it.
It guarantees equal opportunity employment and resources and access for people with disabilities.
Pretty much. It gives rights to people with disabilities, pretty much what we're looking at. The Family and Medical Leave Act. Somebody tell me something about that.
It's for work.
Who's used, has anybody used FEMLA?
My
I've
mom
used it.
FMLA. Mhm.
Yeah, so when you use it, you know, you're using it's exactly what it says. Family and Medical Leave Act. So if there's something medical with you or the family, you take this, okay? And it protects your rights for employment. So that's important there. All right, we look at adults and older adults. We already talked about this. What is going to be our primary focus with them?
elderly abuse.
Abuse. So we are going to assess who's in the home with them. We're going to say who's responsible for the decision making. Be very careful about finances of older adults, particularly if somebody else is managing their finances. That's a red flag for you. Okay. Anybody work with older people?
I do.
Yeah. So have you ever seen this? Any elder abuse?
Actually, I have. We had this one lady. She was. We had this couple actually, in their mid-70s. and the husband, he was actually our patient, and he, I'm not sure if he had Alzheimer's, but he had some type of he had issues with his memory, and so sometimes he would just forget where he's at, forget where he's going, and just look at you, and the lights on, but nobody's home. And so what his wife was doing, she would bring him to his appointment and just leave him there.
Mm.
And when I say leave him there, I don't mean just, oh, left him for an hour. No, she would drop him off at 9 o'clock, and we'd be calling at like 4:30, like, ma'am, you have to come get your husband. And so she did it in our office, she did it at the ER. And so finally what it came out was she was having her own medical issues, and she was just really, really tired, and she couldn't physically take care of him anymore. So that's why she would bring him to his appointments and leave him, thinking that because he's a veteran, that we would put him, in nursing home or something like that. But it doesn't quite work like that. So
No.
yeah,
It's true.
so so that was kind of disheartening, and and that's one of the times I couldn't judge, because initially you think like, what is she doing? Why is she just neglecting him? But then after you talk and get the whole story, and she had a plethora of issues herself, so it was rough.
Yeah, and that's the thing. So there was a lot deeper to that than just what would look superficially like abuse, right? Because to her, she needed help, right?
Yeah. Yes.
Yeah, and older people, the way I think about this, like when I try to remember like the developmental things, like think about these people. So you've lived your whole life, right? And regardless what choices you've made in life, but at the end of your life is when people are going to mistreat you, just like when because you're vulnerable, you're vulnerable to abuse. It's very sad. Financial abuse is huge. People take money. Sons and daughters take money of people, and
I've been in situations with what you said with financial abuse, like my grandfather. We went through that a lot with him, where certain like cousins of mine or aunts and uncles, because he passed away in December. He was sick. He had renal failure, diabetes. He lost a foot, and they would he was really independent up until then. Like even when he first got on dialysis, he drove himself to dialysis. He was almost 80. And when he started needing help to get around places, that's when it kind of sunk their teeth in to realize that he was at that moment where he needed people for the first time in a long time. And it was a lot of buying houses for people and starting businesses for people and stuff like that, where they would leverage, caring for him or bringing him meals, taking him to appointments and stuff like that for big sums of money. And we had to get DCF involved and all that stuff. It was like a thing.
And it's sad because these are the people that they've worked their whole lives, and this is how they end. I just need 1 second from you guys. All right, so we skipped one part I forgot about with kids, and somebody, I think Pete, you said it. What is something we worry about with kids? Do you remember?
Firearms.
Yep.
Yeah, firearms.
Yep, it's a big one. I don't know what the rules are in other states. I do know in the state of Colorado, it's free to carry. You go take a class. You get certified or whatever. What we want to be really careful about with guns and kids is what?
That they're locked up or in a case. The ammunition needs to be separate.
Unarmed, things like that.
So what if you come into a client's house and they say, oh, well, I have it locked? What's your concern when they say that?
Where they're asked to see where it's at, asked to see it.
And remind them that the safe or whatever it's locked with, they should choose a combination that is not easy for the child to figure out. Don't use the kid's birthday or something like that.
And you have to be really sensitive to it. And I'll give you guys a little story just to put it in perspective. My old neighbor was a detective on the police force. And so he kept a loaded gun. never locked on the top of his refrigerator and had 2 young children. And so I said to him, now I wasn't community nursing, I was just trying to educate. And I said, well, what are you thinking about that? He's a very dear friend of mine. So I said, well, what if the kids get it? And he said, I've taught them, they would never touch it. Well, you know, maybe, but why would you even take that risk? So something like that would need a further intervention, right? Something like that would have to be like, you know, and some people aren't going to listen. Some people think guns are great things, and for some people they are. So you just have to be real sensitive to that and to where they're storing it. I like what you said, Barbara. Where are you storing that? Where are the pieces? Does your child know? Those kind of things. You got to be really careful with kids and firearms for, you know, plenty of reasons. You know, we see all the time in society, kids are finding them at the high school age and taking them, and you know what happens. And you know, you know, mental health is not stable, and then they bring the guns, and then they, you know, it's mass shooting. So something to be really careful about with kids of all ages, really. But all right, so we look at older people. When we're looking at, what else can we look at? With our adults, we're going to look at our chronic diseases that they have. You know, these are our older people, like our dementia, depression. They're like, they don't move as well. You know, they may not go to the bathroom as well. They may not keep themselves clean as well. All those kind of things we look at. What else can we look at? We're going to focus here too a little bit on gender specifics on adults. So when we're looking at men, we're going to think about like what cancers are we going to talk to them about. So we talk about prostate and testicular is pretty common there. Erectile dysfunction, it's the reality of the world. It happens. So we're going to have to not necessarily ask about that, but make sure we're real therapeutic on our technique on, is anything happening? Because I don't know if you've heard, but if they take too much of it, it can cause all kinds of problems. So you want to really monitor that, make sure they're taking the right dosing and things like that. With women, we're going to worry about eating disorders. Still our priority with women is eating disorders. We do worry about their reproductive health. We do worry about, you know, all their you know, menopause, breast cancer, osteoporosis. We worry about that, but our priority with women is going to be our eating disorders. And we look at that just pretty much as our last group. Are there any questions about what we're focusing on for different age groups? All right, so what we're going to do at this point is we're going to do a Kahoot, because you guys all look like you're ready to fall asleep. So let's do a Kahoot. Hold on. Okay. Everybody remember Kahoot? We did one last week, didn't we? Or did we not? Everybody know what a Kahoot is? Yay, nay, maybe. Okay, so a Kahoot is where there'll be questions and you guys will have the answers in front of you, and then you click on yours. I'm going to give you it's kahoot.it is our website, and then I'm going to give you a pin in a second. It's just misbehaving as usual. This is the story of my life and internet, but okay, hold on. And this Kahoot is going to be nice because it's kind of reviewing what everything we did during the during tonight's session. So that's good. And then we have school nursing to cover. I'm going to do a video on that, and then we're just going to talk.
Do you want us to get on that on our phones?
Do you want you to what? Get the Kahoot on your phone?
Yeah.
Can you not pull it up on the thingy on your computer?
Yeah, then we will be out of the.
It's okay. I'm not going to see you anyway. Is that what you mean? You have to turn your camera off?
Yeah, we would have to be out of Zoom to be in the Kahoot.
No, you just open another window.
Oh, okay. Yeah, that's true.
Right. All right, just give me 1 second. I'm opening it, but it's like. Let's see here. So sorry, guys. It like logged me out of the Kahoot, and now I'm trying to get back in, and it won't let me. Okay. All right, here we go. Alrighty. I'm loading our pin, and then I'll share the screen. All right, here's our pin. So you're on Kahoot, and then you do 5641956. And then you could, I don't care what you put in as your name. You can put whatever you want.
Hi, Professor Alani. It's Kylie Saboni from Dr. Alani's class. Did you see my message?
So sorry, Kylie, I did. It is Friday, 4 p.m. Same Zoom.
Okay. Thank you very much. I just wanted to make sure I got everyone's review session. Thank
No,
you.
you're good. They'll be recorded too, remember?
All right. Okay.
Okay.
Fantastic. Thank you.
Sure. All right, we ready to play, guys? Okay, here we go. Oops. Which of the following must be firmly established before doing a family assessment? Oh, look at that. So our answers are, you guys liked the wrong one. Oh, well. So most convenient time for you to visit, you need to make sure you know that, right? Because if it's not a good time for you, it's not a good time for them. Not good. The rationale or purpose, why we're going, and why do we need the data? What are we looking for? Why did we pick how to best interview each individual family? Anybody want to share? I appreciate you sharing if you picked it, because I'd like to know where we're thinking. Nobody's gonna fess up.
I picked it because it's important to know like the family composition and how you're gonna approach the interview before you go in to assess the family.
Okay, but it's how to best interview each individual in the family. How could we establish that before we begin our family assessment? Do we know who's in the family? Maybe, maybe not, right? And so how to best interview each individual, we're not going to know the individuals, right? So that's why that answer would not be correct. But thank you for sharing. All right, here goes the next one. RN request to meet a newly referred family in the home, which best explains the rationale for this request. The family will feel more comfortable, the nurse can assess. Families typically welcome others into their home. More family members can typically be involved. I will tell you, it's multi-select. All righty, we did way better. Good work, guys. All right, so the family will feel more comfortable in their own home. People always do. You can assess a lot in a home, right? Think about the things you'd see in someone's home. What are some things that are going to help you with your assessment other than the people that are in the home?
Like safety stuff, if there's tripping hazards, like rugs and stuff.
Yep, yep. What else?
How they react with each other.
Absolutely. What other things are we gonna see in a home that's gonna give us some clues about the family?
The cleanliness of the home.
Mm-hmm.
Like if they need any teaching, like say if someone uses oxygen and like somebody smokes or something like that.
Think about also like pictures on the wall. What's that gonna tell us? That can tell us a lot. Sometimes if you walk into a home and there's a cross on the wall, what does that tell you? It's valuable to that family. Religion is valuable to that family at some point, at some level, right? Or you see a picture of the family and there's, 6 people who aren't in the house at the time. You can tell a lot about just looking around. Okay. All right, here we go. Next one. Which of the following factors must be considered before deciding a plan of action? They agree, they learn better from the nurse's plan, they're capable of the required actions, or the nurse has informed the family how to complete. So remember, deciding on an appropriate plan of action. Alrighty, so we were kind of split here on family agrees to the nurse's plan and they're capable. So I like that a lot of you picked capable. So it's fine if they agree, right? If you give them a plan, great. But what if they can't do it? They're gonna be like, and I don't know how much experience you guys have of this, but I have a lot of it. And particularly with English English as a second language, a lot of times you just get this head shake, regardless of what you say. And so if a family is just saying they agree, maybe they don't understand what the plan is. So they just say, okay, because you're the nurse and you know the answer, right? So think about that when you're evaluating something like that. They have to be able to do it.
It's like what you learn in every other class about patient education. The first step in educating a patient is to assess their level of understanding before you start to educate them.
Yeah, and not even that, you have to make sure they can do it. I mean, think about a patient that has, a newly diagnosed diabetic. If nobody in the family is capable of knowing the difference between 1 and 1.5 on a syringe, I mean, you're gonna have a problem, right? All right, good. Which statement best explains why family functions and structures create unique challenges in family nursing? Function and structure change over time. Functions do not apply. Some clients don't have families. Traditional families are rare in society. Oh, good. Most of us picked that. So some of us picked function and structure do not apply to all family units. Yeah, but the key word on this one is which best explains. So between the two, you have to be really careful when you are looking at families and their dynamics, because that can change in a second, right? Yes, their structure is not all the same, but it can change very, very quickly in community nursing. So good, you guys did good on that one. Termination phase. So we didn't talk about the phases, but this is something in your reading. Which is the termination phase? Increasing sessions with the nurse, providing an evaluation of the relationship, making referrals, and refusing additional communication. Okay, so we were tied between 6 and 8. Oh, okay. Somebody who chose 8, tell me why you chose 8. And even if you didn't know what the phases were of the nurse-family relationship, it has the word terminate in it. So you just, by process of elimination, we should know it's towards the end, like we're terminating. So go ahead. Anybody who picked blue.
Okay.
Well, they still need to be seen, so you would refer them to another RN to take on the caseload.
Okay. Could be.
Refer to community services.
Good. You're going to refer
Or
to them.
specialty centers for specific things that they're dealing with.
You're not going to evaluate, and I'll tell you why. Because nice for the nurse to know, but like, what does it really matter at this point? You're terminating that relationship. So whether it was a good one or a bad one, who cares, right? I mean, not who cares, but what does that have to do with the family, okay? All right, we're gonna look at this one. RN calls the family to arrange the first home visit. Which information should the nurse share with the family? Multiple choice here. How many visits, the cost of the visit, the reason for the visit, or everything the nurse knows about the family?
It's only letting me select one.
It's okay. All right, so if I read this question, I would have picked red and blue, but I didn't clearly, so it's blue, the reason for the visit. So I think the reason it would not be A is because that's further along. That's not initially, because you don't know how many visits you're going to do. You got to do your assessment first. Does that make sense? You got to assess before you know how many visits. Okay. All right, here we go. Number 7. Okay. So this is in your reading as well. It's genomic healthcare. Even if you didn't know this, we didn't discuss this in class because it goes into detail. I do want you to know about this though. What do you think? There's a word in there that should help you. Good, you guys got it, and we didn't even talk about it. Excellent. So it has the word gene right in there. So you're going to be looking at family health risks and see how that is. Remember, we said the eco map is going to be environmental, and genomic or a genograph is going to be when you're dealing with genes or family health risks, things like that. Or we'll do one more and then we're done because we'll do school nursing. All right, doing a health risk appraisal. Which of the following should we use? Remember, health risk appraisal. Alrighty, so what does health risk mean to you?
Anything that is it potentially a risk for your health, whether it's food that you eat or an activity that you're doing, or smoking or possible cancer or something.
Yep. So our risk is the key word there. So we're looking for something that will put them in put them in more likely to be have a health concern, right? So health promotion activities has nothing to do with what kind of lifestyle are we living. Illness prevention activities is not going to put us at risk, nor risk reducing activities. What we're going to look at is our unhealthy ones. Okay, good work, guys. You did well on that. All right, so stop sharing. Okay, and we're going to watch a quick video on school nursing, and then we'll talk about it a little bit, and then we're done. Yeah, hold on, I gotta do my thing down here. You guys can hear it. It's not populating. Oh, there it is. Oh, come back.
I am a nurse. The thing that would surprise people mostly about school nursing, one day you could have 10 kids come into you and have a lot of respiratory conditions, or a day could be a slower day where you're just doing health screenings that have to be done. You never know when that emergency is going to take place. And as the school nurse of the building, you have to be ready and prepared to address it. This is called a peak flow meter. As a school nurse, you are the counselor, you are the mother, you are a mentor, you're a little bit of everything for that child. What this is a compressor. It is helping the family as well. Many times parents have to be brought into the picture.
Not feeling good.
In order to educate a child must be healthy. How's everybody today? Good. And a child must be healthy to be educated. Who had breakfast this morning? Just raise your hand. If you can bring in those healthy choices and healthy habits into their lives while they're young and have their families make the adjustments, you're ahead of the game. The best part of the job is going to work every day, seeing those children. They smile at you and you smile at them. That's like, hey, you know what? They appreciate me. They respect me. They understand that I am here for them.
See, what are you doing?
Working as a school nurse has afforded me the time to have time for my family. We make a point of having dinner together at least 4 nights a week. We get together and play games, and it gives us that sense that, you know, we're still all a part of each other, which families are supposed to be. And that's what it's all about, is realizing that the definition of family is that togetherness.
Joey, take the center, Chris, take the forward.
My husband is an assistant commissioner in our town for basketball. In addition, he's done coaching. On occasion, I help him out on the sidelines.
Come on, guys, come on.
When you're coaching, it's all about guidance and steering them in the right direction. Come on, make sure it reaches them. And as a nurse, you're doing the same thing.
Come up and put it on.
Helping people has really meant a lot to me since I was a little girl. I knew this from probably about maybe 5th or 6th grade that I wanted to become a nurse. That's what I was meant to be. I was meant to be a nurse. I am a wife. I am a mother. I am a mentor. And I love being a school nurse.
All right, we're gonna stop there. I just thought that was a great video because you see what school nurses do. And I will tell you that I went into school nursing because of a family. I lost my mother, and I couldn't be in a hospital setting anymore. I couldn't. It was very, very traumatic for me, and a loss that I can't even explain. So I needed to do something where I was out of that clinical environment and giving of myself. So being around kids has just makes your life just a little happier. Not everything about kids is happy, but what I will tell you is the littlest things will make them smile. The littlest things will, you know, they'll wave to you and make you feel good for the day. So just remember that. As a school nurse, a lot of people say, oh, why are you doing that? You know, there's no emergency in it. And let me tell you something, there's emergency. I have seizures in the building. I had a little kindergartner who had a seizure in the middle of the floor. Nobody knew about it. Walked around her, thought she was misbehaving, walked around her, and then you see it on the camera and can't believe it. But I mean, that's medical, you know, you apply your medicine in the school setting. There is really nothing quite like it. The school nurse is a very, very big mental health provider. I already said to you guys, I can't tell you the amount of kids that come to me and they'll say, oh, my dad threw me on the ground last night and beat me with the belt, as if he said he went to the beach yesterday. You know, they're very transparent oftentimes, and they confide in a nurse because you're a safety that's not requiring a lot of them, right? You don't make them do homework. You don't tell them they have to behave. You don't tell them anything. So as a school nurse, you really got to assess the whole picture. So when they come in with a stomach ache, a lot of times there's a stomach ache. I call it stomach aches are usually benign, meaning they're kind of, nah, there's something else going on there. So I have kids that would come to me frequently with a stomach ache at 12:05 every day because they were doing math at 12:05. So, you know, as a school nurse, you got to look at the whole picture and really assess these kids. I could have been worried that they had some, you know, bleed or a GI bleed or something, but I kind of was like, something doesn't seem right. You can usually sense it from kids, you know? So, I want you to know school nurses spend a lot of time on immunizations, on keeping the community healthy. I speak with parents all day long and give them resources, help them get insurance, help them call. Who do I call? What do I do? It's tons and tons of family work there and a lot of mental health work with school nursing. So it's a profession and I love it. And I never would have believed I would have gone into it, but things in life change you forever. And so that put me in school nursing and it's been a great position. The other thing is that I liked about in the video, and this is so true. I worked in a hospital for 15 years. I worked every Christmas Eve for the first 9 years of my daughter's life. So being a school nurse, I have off 2 weeks of Christmas. I have off the whole summer. I have off President's Day, Martin Luther King Day. I mean, kinds of things that you in a clinical setting, you're just not going to have. Even doctor's offices don't have as much time off. I have the entire summer from the end of May until the beginning of August. I have off. I mean, it's amazing to me. And there's some real benefit to being in a school setting and being able to provide for children and helping them, the best you can. So keep that in mind when you're asked questions about school nursing. There's a lot of teaching. There's a lot of resource giving. This is what we're going to do. This is what we do, those kind of things. So I did it really quick because I'll talk about school nursing throughout our class because obviously it's firsthand to me. But I just wanted to really touch on the things we would focus on for school nursing. There's a PowerPoint that goes with it. I'll send it to you guys as well. I'm not going to go over it. And are there any questions on the school nursing chapter? No? Very good. So like I always do at the end of class, what I want you to do is ask for any questions.
Are you going to send out the exam study guide?
Yeah, as soon as I get it.
When it comes to the groups for the project, do you know when you'll be assigning those?
Yeah, let's take a look at our syllabus and I'll tell you when I'm going to assign that. I mean, I can sign it. Oops. I can assign it by, do you guys want it by tomorrow? I can do it by tomorrow. The groups by tomorrow. And I have to write things down or else I always forget. Study guide. We're going to take a look at this week and see what we need for this week. So let's pull up our syllabus. Hold on one second.
The exam is next week, right?
Yep. During our class, and expect to come back after the exam because we have stuff that we cover. It's not going to be a lot though, trust me. All right, so let's share my screen. So tomorrow by what do you call it? By 6 o'clock your time, you're going to get me the our attestation questions. We'll look at really quickly. So I'll help you with the answers there. So this week we're doing discussion question number 1. Remember, due by Wednesday, response by Sunday, 50 NCLEX questions, attestation, and we're preparing for our Unit 1 Foundations exam. Chapters 1, 3, 18, 21, and Healthy People 2020, and it says on here 2030. What I will tell you is the boxes in your chapters that tell you about the objectives for healthy people, you need to know them. They are on the test throughout the chapter. They're all throughout. Primary, secondary, tertiary, need to know it. So get it down. Prevention, screening, treatment. That will definitely be on there. What else? Is that it? Well, we're at the end of class, so I hope we don't have anything else, right? Any questions for the good of the people?
When is Professor Lundy sending out the other times for the review sessions?
I don't know. I'll text her tonight.
Okay.
So the only things due this week are the discussion and the attestation and then studying for the exam, right?
No, the NCLEX as well.
Oh, yeah. Okay.
Okay. Discussion question, though. I need you guys to respond. Post by Wednesday. Respond by Sunday. If you don't, I can't give you credit. So you guys got to get that done. Get the attestation done. What I would tell you to do for attestation questions is when we end class, like get up, walk around, do your thing, answer the attestation and submit them, and then you're done. Okay, because we reviewed the topics in class today. Don't forget, for our exam, you're going to download 48 hours prior to the exam. You're going to have 2 pieces of technology. You're going to have a cell phone and you're going to have your computer. You're going to be on the whole time. You'll be watched by 2 professors. And I have 0 tolerance. I will tell you, I have 0 tolerance for disintegrity, meaning cheating on a test. You do yourself no good, trust me, because you're not going to be able to cheat on an NCLEX. So you do yourself no justice. You do no good for anybody. So just realize that. And if it crosses your mind, get it out of your head, because that's not values of, nursing as a whole, right? Any questions? Study guides going out. PowerPoints I'll send out right now. And then study guide, I'm going to text Dr. Lundy and ask her about that. I don't know why. Usually we get the schedule, but I didn't see it, so I'll double check. All right, any questions? All right, guys, thanks for a good night. I wish you the best of luck studying. If you have any questions, you text me, email me. I'm happy to meet with you privately, okay? Those at-risk students, like I told you about, please meet with me privately to study for the test. Okay?
Thank you.
All right, have a good night, everybody.
Thank you.